Hello friends, myself Dr. Love Krishna Pal Singh Rathore, Assistant Professor Shalya Tantra GIA. Today we are discussing about the Bertholin gland. First we have to see about the anatomy. Situated in superficial perineal pouch, size it is pea size of about 0.5 centimeter. It is yellowish white in color. What is the function of gland? Used during sexual excitement, it secretes abundant alkaline mucus which help in lubrication. Which each gland has got a duct which measures about 2 centimeters and opens into the vestibule. The duct is lined by columnar epithelium, but near its opening by stratified squamous epithelium. The Bertholin's gland correspond to the bulbourethral gland of male. Now we are coming to our main topic, Bertholin cyst. This is the normal anatomical picture, and the other picture which is showing the Bertholin gland cyst. See the swelling position. There is a closure of duct or the opening of an sinus. They most commonly occur during childbearing years. What are the causes? Infection, trauma, occlusion of the ligaments and STIs. Pathophysiology. A Bertholin's gland cyst develops when the duct that drains the gland becomes blocked. Blockage may be caused by an infection or a mucus plug. The secretion from the Bertholin's gland are retained, forming a cyst. Bertholin's abscess culture often show polymicrobial infection. Lesion of Bertholin gland also occur in carcinomas, Bertholin's gland cancer. Clinical features: asymptomatic and symptomatic. Asymptomatic. Many Bertholin cysts are small and do not cause any symptom other than minor irritation. Symptomatic: discomfort and dyspareunia, walking, sitting, or when inserting a tampon or wiping after using the restroom. Swelling and tenderness in the area, fever or chills, redness, drainage from the cyst, change in size. The examination of Bertholin cyst. A small site often remains unnoticed. Examination reveals an unilateral swelling on the posterior half of the labium major, which opens up at the posterior end of the labium minor. Overlying skin is thin and shiny. The cyst is fluctuant, non-tender. Sometimes it may be tender in infectious condition. Diagnosis. Other conditions that may present similarly include hydradenoma papilliferum, lipoma, epidermal cyst, and skin duct cyst, among other conditions. In women who are more than 40 years, a biopsy may be recommended to rule out a cancer. Treatment. First, catheter drainage of the abscess cavity following incisional drainage has also been done. Incision and drainage. And third, the most important, the marsupialization. It is the gratifying surgery for Bertholin cyst. Procedure. An incision is made on the inner aspect of the labium minor just outside the hymenal ring. The incision includes the vaginal wall and cyst wall. The cut margin of the other side are to be trimmed off to make the opening an elliptical shape and of about 1 centimeter in diameter. The edges of the vaginal and cyst wall are sutured by the interrupted catgut, thus leaving behind a clean circular opening. Ciprofloxacin or second generation cephalosporin are used to control infection. This is the picture which is showing the catheter drainage of Bertholin cyst abscess. See, first incision taken and then catheter put inside. This is the picture showing incision and drainage and then suturing it done. This is the picture showing marsupialization of Bertholin cyst. Now I am showing a case of Bertholin cyst. Name is this. We are now discussing about this. History of present. 5 years ago, she had a small cyst felt but not having any type of pain and any discomfort, so she was ignored it. 2.5 years ago, she went to hospital and drained out the fluid from the cyst. From past 6 months, growth rate was increased. Before OT, it was 3 by 2 centimeter, so she was consulted our hospital. Actually, this was a recurrent Bertholin cyst. Pre-op we done about all required investigations. Directly we are coming to the pictures.